welcome to St. Lucia Magazine, a weekly roundup of the nation's top stories in education, the economy, infrastructure, agriculture, and more. I am your host, Kishma Seri. In this edition, the government of St. Lucia removes the guarantor requirement for government scholarships, and St. Lucia is charting a new course for sustainable food and nutrition security. To begin this recap, Prime Minister Honorable Philip J. Pierre has announced a major policy change aimed at improving access to higher education for students from low-income families. Effective immediately, students who receive government scholarships will no longer be required to provide a financial guarantee, which often limited opportunities for those most in need.
The government of St. Lucia has decided that we are going to remove the need for a financial guarantee for students who get scholarships to go to study at institutions of higher learning. We introduced first generation scholarship, which was intended or is intended for students who come from homes, from families where no one has gone to a university. We call it first generation scholarships. But with that, there came the need for financial guarantee. Now, if a family cannot afford to send not one of their members to university, it follows that they don't have the financial means. So how can you ask them for a financial guarantee? So you are not targeting the people you need to target if you're asking for financial guarantee. So the company decided that we would remove the need for financial guarantee and ask the students who get the scholarships to give a character reference, in that somebody will testify that they are of good character, etc., and they will be bonded to work. But the need for financial guarantee is stopped from today. There'll be no need for financial guarantee for students when they get a scholarship. That's going to help many, many students from lower income families who would not be able to get this guarantee. So the government has decided that from today, when you get a scholarship, there is no need for financial guarantor.
Deputy Prime Minister and Minister for Tourism, Honorable Dr. Ernest Hilaire, has unveiled a bold plan to expand the Choiseul community tourism model across St. Lucia. Speaking at the reopening of the upgraded Choiseul Arts and Crafts Center, Dr. Hilaire said the initiative will drive sustainable community-led tourism, empowering local artisans and entrepreneurs while enriching St. Lucia's cultural offerings. Claudia Monry has the details.
The Honorable Dr. Ernest Hilaire, Deputy Prime Minister and Minister for Tourism, Investment and Creative Industries, Culture and Information, has unveiled a bold vision to replicate the Choiseul community tourism model across all constituencies in St. Lucia. Speaking at the official launch of the newly upgraded Choiseul Arts and Crafts Center, the Minister emphasized that community-driven tourism will be a cornerstone of sustainable development on the island.
A lot of thinking went into how can this place be established to ensure we give it a better chance of survival. And of course, when we launched the Community Tourism Agency, we started discussing about different experiences that can be created all over St. Lucia. And I must take this opportunity to thank the Permanent Secretary and the team at the CTA and at the Ministry of Tourism for some of the ideas that we've come up with in ensuring that we can enhance the touristic experiences in St. Lucia.
The significantly enhanced Choiseul Arts and Crafts Center represents an investment of approximately $800,000. The facility now features artisan studios, a meeting room, a training room, and exhibition area, bar area, and administrative offices. It is also equipped with brand new appliances and equipment to support small business development, artisan training, and cultural showcases. The minister highlighted that strong collaboration among key stakeholders remains essential to refining Choisel's full potential as a premier community tourism experience. The National Skills Development Center, NSDC, will serve as the custodian of the Choisel Arts and Crafts Center. Through this partnership, NSDC will roll out comprehensive training and entrepreneurial programs designed to build local capacity, enhance service quality, and ensure that visitors and locals enjoy a truly memorable Choiseul experience. This initiative aligns with the government of St. Lucia's broader tourism strategy to foster inclusive community-led development, empowering local entrepreneurs and artisans to benefit more directly from the tourism economy.
Still to come, the Ministry for Equity and World Food Program advancing St. Lucia's anticipatory action. Please stay with us.
From Castries to Cuba, St. Lucia FM. Your stories, your rhythm, your radio, your voice. St. Lucia FM.
97.3 St. Lucia FM.
Welcome back. St. Lucia is stepping up its hurricane preparedness. The Ministry of Equity and the UN World Food Program are strengthening the island's anticipatory action systems, designed to deliver early support to vulnerable families before the storm hits. The move follows a recent review of the country's full-scale simulation exercise.
When a hurricane threatens, St. Lucia is acting early. The Ministry of Equity, Social Justice and Empowerment, in collaboration with the United Nations World Food Program WFP, has reaffirmed its commitment to strengthening St. Lucia's anticipatory action mechanism following a stakeholder meeting held to review the findings of the nation's first full-scale simulation exercise. The meeting, hosted at the ministry's conference room on October 16, brought together representatives of the WFP, the Accountant General's Department, the St. Lucia Meteorological Service, and Massey Stores as a key private sector partner. Discussions focused on lessons from the May 2025 simulation exercise, which tested the delivery of early assistance to vulnerable households ahead of a hurricane. The exercise was designed to test the readiness of national systems and partners to deliver assistance before a hurricane makes landfall. St. Lucia's anticipatory action mechanism, the first of its kind in the English and Dutch-speaking Caribbean, enables the preemptive delivery of assistance to about 2,000 pre-identified households when a Category 1 hurricane or stronger is forecast. The system uses a two-stage trigger based on 5-day and 3-day forecast to activate the early release of funds in cash or food vouchers.
We are very prepared. We did get some support from the World Food Program to hire some individuals who have been assisting with the sensitization of our project beneficiaries. These individuals have also been assisting with the verification of bank account information of the various project beneficiaries. And with these processes being in place, we are in a very comfortable state that if a Category 1 hurricane were to be approaching St. Lucia, our systems are well oiled. We are ready to go.
The simulation confirmed that electronic payments could be completed within a few hours of activation and vouchers distributed within 4 hours of activation, demonstrating the feasibility of government-led anticipatory action. The exercise also identified areas for refinement, including stronger communication with beneficiaries, closer coordination with the Treasury, and improved data management.
So we really came together to review what we had done in the anticipatory action simulation in May of this year. We had tested the anticipatory action system. We wanted to see how robust it was, how viable it was. And that simulation gave us a lot of lessons learned. It helped us identify the gaps, in particularly interagency coordination. So the stakeholders came together today to revise the lessons learned from that simulation and see how they can improve coordination. The Ministry of Equity, who's leading on the implementation of this anticipatory action mechanism, brought together key stakeholders who are critical to ensuring its success. Of course, WFP was there because we are providing technical assistance to the government of St. Lucia. The Met Services, who is critical in letting us know when a hurricane is approaching so that we can better prepare and trigger the mechanism. We had the Ministry of Finance, the Treasury Department, and Marcy Stores, a critical private sector partner.
With approximately EC $600,000 in pre-positioned funds and updated operating procedures, St. Lucia is now better equipped to deliver timely and dignified support to at-risk families before disaster strikes.
St. Lucia is charting a new course for sustainable food and nutrition security. Stakeholders from across the island gathered at Bay Gardens Resort for a national dialogue hosted by the Ministry of Agriculture and the UN to advance the food security systems transformation and to promote resilient, inclusive, and healthy communities. Chevron Marius has the details.
A renewed national drive towards sustainable food production and healthier communities took center stage as stakeholders from across St. Lucia united to chart the next phase of the island's food system transformation pathway. The high-level dialogue held on October 23, 2025 at the Bay Gardens Resort Rodney Bay served as a powerful platform to accelerate St. Lucia's transition towards a more resilient, inclusive, and nutrition food secure system. Hosted by the Ministry of Agriculture, Fisheries, Food Security and Rural Development in collaboration with the United Nations Resident Coordinator's Office for Barbados and the Eastern Caribbean, the dialogue brought together national stakeholders, farmers, feature folks, policymakers, youth, women's organizations, civil society, and international development partners to validate and advance St. Lucia's national food system transformation pathway. This initiative aligns with the United Nations Food Systems Summit framework, which seeks to promote global food systems in support of Sustainable Development Goals by 2030. Head of the United Nations Resident Coordinator's Office for Barbados and the Eastern Caribbean, Kenroy Roach, highlighted the importance of collective regional action and partnerships in transforming food systems for the benefit of all.
So what we're trying to do here is promote food systems. And what that basically means is building an ecosystem of actors and actions to ensure that there is food and nutrition security in the region.
The dialogue emphasized multi-sectoral collaboration in addressing key challenges such as climate change, equitable livelihoods, and the growing threat of non-communicable diseases. By promoting innovation, youth participation, and sustainable farming practices, the discussion reaffirms St. Lucia's commitment by building resilient and inclusive food systems. Deputy Permanent Secretary in the Ministry of Agriculture, Fisheries, Food Security and Rural Development, Dr. Randall Esnad, explained that the dialogue serves as a foundation for policies and programs designed to improve livelihoods, reduce poverty, and ensure equitable access to nutritious food.
The whole purpose of this is to really guide the ministry to develop policies and programs that are geared towards achieving the SDGs, zero hunger, building resilience in the agricultural sector, reducing poverty. So really and truly, this document is kind of like the cornerstone of the national efforts.
The dialogue's breakout sessions focused on 4 thematic areas: food and nutrition security, equitable livelihoods, climate-smart production, and resilience to vulnerabilities and shocks. These discussions generated practical recommendations to enhance agricultural productivity, improve policy alignment, and strengthen interagency coordination across sectors such as health, education, and commerce. Permanent Secretary in the Ministry of Agriculture, Fisheries, Food Security and Rural Development, Bradley Saint-Ange, emphasized that the success of the transformative pathway lies in St. Lucia's ability to adapt to its national priorities and ensure strong local ownership.
The success of this pathway depends on national ownership. It must not remain a report on a shelf or a concept driven by external partners. It is our ministry's mandate and our collective responsibility to bring it to life through our policies, our programs, and our partnerships.
The National Dialogue on Food Systems Transformation marks a critical step towards uniting national and regional stakeholders to address St. Lucia's food security challenges through a sustainable, inclusive, and resilient approach. From the Ministry of Agriculture, Fisheries, Food Security, and Rural Development, Chevroy Marius.
Residents of Mico and surrounding communities came together for a walk to honor breast cancer survivors and fighters. The event, held at the Mico Wellness Center, promoted awareness, early detection, and free screening services while encouraging healthier lifestyles through exercise and community engagement. Fidel Neptune reports.
Residents from Mico and surrounding communities recently joined forces and united to show support and celebrate breast cancer survivors and fighters with a 5K walk in the community of Mico. The 5K walk, which commenced at the Mico Wellness Center, ended at Veg Point with an exercise and aerobic session by a fitness instructor. This activity provided community members with an opportunity to be part of the powerful movement to raise awareness and make a difference in the fight against breast cancer. As part of ensuring early diagnosis and screening for breast cancer, women were provided with breast examinations and to take advantage of mammography services available at no cost under the Universal Health Coverage UHC. Registered nurse Mikkel Bika says, in response to the rising breast cancer rates in St. Lucia, the walk serves as a great activity to honor breast cancer survivors and fighters in the community and to also increase awareness of early detection and risk factors.
As you may know, October is Breast Cancer Awareness Month, and we have a lot of clients in the community who are diagnosed that we the nurses know about, who are being treated and who are also survivors. So we wanted to make them feel that we know, we care, we are there. And we're also helping in the process, we're helping in the fight. Even though we may not be there physically, but emotionally we're there. They're in our thoughts, they're in our minds. And we just wanted our presence known in the community and in the region as well.
Participant from the community of Monrepo, Andrew Ferdinand, praised the walk and physical activity and committed to continue supporting.
I took part in it last year, and I really enjoyed the walking, the exercise, and meeting new friends, meeting more people. So that's why I take part in it this year. And I feel more comfortable this year in this walk because it had a little more people. And then it was nice. So I always enjoy the walk. The exercise is good. The food is good. So I'll try and take part in it every time they have it, as long as I can.
Health educator Shulan Edward encouraged community members to utilize the services available at the community wellness centers and get regular screening for breast cancer.
Come out, do your screenings. Early detection can save your life. If you are a survivor, I would like you to encourage other persons to get screened because screening actually helps persons be aware of what is happening. When you come in, it's not for persons to just know that you have breast cancer. We are not screening to get breast cancer or get cancers. We are screening so that you understand where you start, what you start doing. So at least you'll be able to go through the steps of treating yourself and managing the condition. So we're asking persons to not just screen only in October, but we're asking persons to come out. The health centers, the wellness centers are there. The service is free, so come out and do your screenings. If you are not able to come out this month, we are open for all the week so that you can come in and get screened, your breast screening. Bring a friend, bring somebody, explain to them, talk to them about cancer, talk to them about breast cancer, the importance of screening so that they too can come out and get screened.
Participants also got the opportunity to get health screening undertaken, such as blood sugar testing, blood pressure testing, and BMI. Reporting from the Communications Unit of the Ministry of Health, Wellness and Elderly Affairs, I am Fidel Neptune.
Coming up next, Victoria Hospital officially renamed as the Dr. Winston C.V. Paris Medical Complex.
This is an iguana. This is our white rattle, just two of our friendly neighbors that share these 238 square miles. These unique citizens are also protected by law. If broken, Penalties can reach a maximum fine of $5,000 or up to 1 year in jail. Along the Ayanola region, St. Lucia's northeast coast, lives some unique and rare wildlife, some found nowhere else on the planet. This is an iguana. They are ours to protect. This announcement is brought to you with the compliments of the Ayanola Project.
Welcome back. Victoria Hospital has officially been renamed the Dr. Winston C.V. Paris Medical Complex in honor of Sir Dr. Winston Paris, whose pioneering work in anesthesiology, pain management, and medical mentorship has left a lasting mark on St. Lucia's health sector. The renaming celebrates his legacy, commitment to advancing healthcare across the nation. Here again is Female Neptune.
The Ministry of Health, Wellness and Elderly Affairs has officially renamed the Victoria Hospital as the Dr. Winston C.V. Paris Medical Complex. The hospital was renamed in honor and recognition of the valuable contribution of Sir Dr. Winston C.V. Paris, who worked as the only consultant anesthesiologist at the Victoria Hospital and dedicated his service in the area of pain management. Permanent Secretary in the Ministry of Health, Jenny Daniel, recognized the renaming of the Victoria Hospital as a moment of great national significance and tied in the noteworthy contribution of Sir Dr. Paris to the health sector.
Today, we are not simply renaming a building, we are preserving its legacy while honoring one of St. Lucia's most distinguished sons, Sir Dr. Winston Paris. Sir Dr. Paris was a man whose life embodied excellence, service, and an unyielding commitment to the advancement of medicine and the well-being of people. His pioneering contributions to clinical medicine, his mentorship of younger doctors, and his unwavering passion for patient care have left an indelible mark on the regional and international community.
Minister for Health, Wellness and Elderly Affairs, the Honorable Moses Jabatis, said he is deeply grateful to Sir Dr. Winston Paris for his contribution and exceptional service over the years working at the Victoria Hospital.
That this government is committed to ensuring that your name, Sir Winston Paris, which will be etched on the walls of this institution, will be associated continually with excellence, the excellence which you brought to the world. We are going to ensure that we continue to work with you to cause St. Lucia's name to continue to be heralded everywhere in the world.
Parliamentary Representative for Castries South, the Honorable Dr. Ernest Haley, welcomed the renaming of the Victoria Hospital and said he is proud to have this health facility located and serving the people of his constituency. Prime Minister the Honorable Philip J. Pierre applauded Sir Dr. Winston Paris for his unwavering contribution to healthcare and said it is unquestionably necessary that he is honored, respected, and loved.
I thank Sir Winston. I want the doctors and nurses to use him as an inspiration, a mentor. Somebody who can come from Marion Street in Castries and reach Duke University, Tennessee, speak to presidents, chair presidential councils, but still return, come back to St. Lucia and remain grounded and remain St. Lucian. I thank you for that.
Sir Dr. Winston C.V. Paris, who was present to unveil the sign bearing the new hospital name, expressed immense pride and joy to have his legacy honored. He also highlighted his vision for the health facility.
My hope for the Dr. Winston Paris Medical Complex is that it would improve the delivery of healthcare in St. Lucia, that it would attract new specialties to this facility, and in particular to St. Lucia, and that it would stimulate research inquiry into complex medical syndromes affecting St. Lucia and the Caribbean people.
The newly named Dr. Winston C.V. Paris Medical Complex is committed to delivering exceptional healthcare service to the people of St. Lucia. The Dr. Winston C.V. Paris Medical Complex comprises the Dr. Betty Wells Urban Polyclinic, that is, National Eye Clinic and Urgent Care, and the Millennium Heights Medical Complex Secondary Care Wing. Reporting from the Communications Unit of the Ministry of Health, Wellness and Elderly Affairs, I am Fennel Neptune.
St. Lucia is strengthening its defense against future health crises with a 3-day workshop designed to develop a national pandemic preparedness and response plan. Health officials and key partners gathered to ensure the island is ready to detect, to respond to, and to recover from potential pandemics.
St. Lucia is taking proactive steps to strengthen its national preparedness for future health emergencies with a 3-day pandemic preparedness and response plan development workshop. The workshop, which was held from October 21st to the 23rd at the Harbour Club Hotel, was hosted by the Ministry of Health, Wellness and Elderly Affairs in collaboration with the Pan American Health Organization and the World Health Organization. Bringing together health professionals and key national partners such as the National Emergency and Management Organization, Customs and Excise Department, and the St. Lucia Fire Service, the workshop aimed to shape a comprehensive plan that will enhance St. Lucia's ability to detect, respond to, and recover from pandemics, particularly those caused by respiratory diseases. To shed light on the significance of this effort, PAHO's advisor for health emergencies, Joanne Passard, explained how this plan fits into the broader vision of preparedness.
The pandemic plan, like any other hazard or disaster plan, is designed really to enhance preparedness for a pandemic threat. As you know, we've had the experience of COVID-19, and there's always that great concern that we will have another pandemic. And therefore, this is overall part of preparing St. Lucia, in particular the Ministry of Health, but many other sectors across public and private sector, because everyone has a role to play. So this is part of preparedness, as I said before, but it's also part of outlining the key course of actions that we need to take as a St. Lucian community, St. Lucian public sector, should there be another threat or impact of a pandemic, a global threat of a communicable or infectious disease. Everybody has a role to play, and there must be good coordination and communication. And those are some of the aspects that this particular plan will look at.
Passard added that PAHO's role in this initiative is to provide technical guidance and ensure the plan reflects St. Lucia's unique realities.
For St. Lucia, we are here to guide, to advise, to provide technical support and cooperation. PAHO has, in the recent past, developed the preparedness and response for emerging threats, the PREP tool. It's a tool that we're supporting in this workshop, supporting the adaptation of to the St. Lucia context. It's a model that has to be tailored, cut, and fitted appropriately to your realities on the ground, your experiences, your capacity, and your ability to respond.
Chief Medical Officer Dr. Sharon Belmar-George emphasized the importance of collaboration across all sectors, noting that the COVID-19 pandemic underscored how health emergencies affect every aspect of life.
I'm really hoping that today we get the feedback and the input from all of the agencies. I think COVID has taught us that health is not Ministry of Health alone. And some of the other agencies also learned that, and we've maintained close relations after COVID because of that. While we oversee the technical aspect of health, it has the impact to shut down an entire country, to shut down full sectors. So your input in guiding this plan is critical. Let us not only see the negative part of COVID, but look at what gains we've had in strengthening health. And let us ensure that whatever gaps that we recognize during COVID will be the only place that they remain gaps. So our new plan would be holistic and to cover fully, to make any CMO that comes in years, make it easier for that team to be able to manage another pandemic.
Once finalized, the Pandemic Preparedness and Response Plan will serve as a roadmap for coordinated national action, ensuring that St. Lucia remains steady, resilient, and capable of responding swiftly to any future public health emergency. From the Communications Unit of the Ministry of Health, Wellness and Elderly Affairs, I am Onika McCoy reporting.
And with that, we wrap up this edition of St. Lucia Magazine. A heartfelt thank you to everyone who contributed to this production: the National Television Network, the GIS team, and the communication officers across various government ministries. Thank you for watching on NTN Channel 122 and for following on the official social media platforms of the Government of St. Lucia. I am Kishma Serna. Until next time, stay informed, stay engaged as we continue tracking St. Lucia's progress.